my patient population now is going back to college. So what's going on? That brings me to my next topic, binge drinking. So what we have here, people who are not alcoholics, I don't think they are. But I had a few people in here that, I just binge drink. Maybe I don't drink for a month, but then I'll go out for 3 days or go on vacation for a week and drink. Here's what I'm getting: 20 to 30 White Claws a day, or Trulies, or High Noons. Or then I get the people like, I don't drink for 3-4 months. I'm not an alcoholic. Then I'll drink a handle and it's over with. Okay. Granted, the odds of you going to liver failure or having serious neurological problems from that are rare. But what happens when you binge drink? What are the risks? You don't have the same problems as a chronic alcoholic who's been drinking every day, a quart every day for years on end. Okay, granted, but binge drinking is dangerous. Now, what is the most common thing I see? Well, first, you're a young guy, your body probably holds up, except for a few things, which I'll discuss, but the most common things are you fall and hit your head, or you hit your elbow or your shoulder. So you have a traumatic accident, or you drive a car. But what I normally see is they're all bruised up, or they hit their head, or I get hand and shoulder injuries. Those are big. So you wind up getting hurt. That's the most common thing. This is in the crowd between ages 15 to, say, 40. Older people, too, when they binge drink, fall and get hurt, but their bodies break down in so many other ways. But the young crowd, they get trauma. Here's another one. I had one guy come in yesterday. We'll call him TK for short, so I don't give away his identity. He said, I drank so much I passed out and I fell asleep in my arm and I didn't move for 12 hours. And yes, you killed the nerves in your arm. He killed his ulnar nerve. Now he has no feeling in here, the ulnar nerve. It's like this finger and part of this finger, and it goes down this part of the arm. He has no feeling. Get this. I had my office in New York. I had a woman fall asleep on a radiator. She leaned up, passed out on the floor against a radiator. Yeah, the radiator was not that hot, but it was hot enough where, 8 or 9 hours without moving and pressed against it, she cooked part of her back against the radiator and was all red and blistered. It was disgusting. So yeah, when you pass out and don't move, you destroy the blood flow and the nerve supply to that area of your body that's cut off. You need to move every 15 seconds, 20 seconds when you're sleeping. The body's constantly moving when we're sleeping. For that reason, hello. What's another big one? I think you're going to drink. You're not going to have any side effects. Well, guess what? Your esophagus and your stomach it looks like chopped meat. It gets ripped apart by the alcohol, turns all red, and it bleeds. So you could cough up blood. That's probably not good for you. What's another one? Well, you scramble your brain. You drink for, even 1, 2, 3, 4, let's say under 2 weeks for this binge. You can't think straight. Maybe takes 3 to 5 days for your brain to clear. And athletic performance deteriorates. You go out and, I would say heavy drinking is more than 1 drink for a woman and more than 2 drink for a man. But my patients, the ones that come to this office, we're talking 20 to 30 White Claws, 20 to 30 Trulies, maybe 15 vodka sodas, 10 shots, plus a few beers. We're talking in the 30 range of drinks a day. And usually it's between 5 and 2 in the morning. So these are the binges of people in my office. So it's pretty intense. You will do damage. Your athletic performance for, I would say, a week after that, when you stop, is down. Your thought process is impaired. You cannot think clearly. You are confused. Now, another thing that happens is, I've lost some patients with this one. So you drink and you go to sleep, right? Well, you've numbed your gag reflex. That's where if something goes into your lungs, you cough it up. You don't cough it up because you're just so numb. So a little contents, because you've been drinking beer or some disgusting White Claw or Truly, which Those things, maybe one's nice, but 20 of them is downright disgusting. But anyway, they cough up a little stuff from their stomach into their lungs, and it causes a severe pneumonia, aspiration pneumonia. Oh, by the way, what you see in back of me here this is 1,000. See this? I have 1,000 YouTube subscribers. Everyone clap. Thank you. Anyway, so when you cough up the stuff, the contents from your stomach into your lung, it's called aspiration pneumonia. You get really sick. And there's different degrees, right? You do a little bit, you think, oh, I have a cough, a cold, it's from drinking. No, you coughed up gastric acid and disgusting contents that are digested in your stomach into your lungs. And now that stuff is just digesting your lungs, and your body walls it off, and you get a horrible cough and fever. And there's degrees where maybe just a little cough, or some people get a full-on pneumonia. It's extremely dangerous. Not to mention, I live in Florida. Binge drinking severely dehydrates your body. And then if you had to go out and perform physical activity in the heat, of course you'll collapse. It's dehydration. I've given many talks where I've talked about long-term consequences. I'm not even getting into that of alcohol abuse, where social issues, financial issues, job issues, family issues from drinking. I'm just talking about the acute binge, where individuals allot time to drink, where there really are no consequences on these other areas. They just sort of say, well, we're off for the next 5 days. I'm going to be drunk the whole time. This is not healthy. It's not good. I had this one patient was in here this morning, and I'm like, he goes, doctor, you're right. I'm not going to drink anymore. I think I'll just smoke pot. And I'm like, ay. Anyway, don't do that either. Let's just try and live a healthy life. All right. Thank you. I'd appreciate likes and subscribing.